So welcome to our very first subject, and this is going to be on altitude explained. Now we're going to just go through the very basics today of what altitude actually is and talk a little bit about altitude sickness as well, because while we're going to build off this in further modules in the course, a lot of people tend to not really understand these basics. And there's a lot of misinformation out there on the internet, which make this whole thing a little bit confusing. So we're just going to tick off each box as we go and just make sure you have a good understanding before we get into it. So let's get into the first one. So what is altitude actually? Basically, high altitude is defined as anything above 2,400 meters roughly, or 8,000 feet. What actually happens at altitude is when you go up on the mountain, is the oxygen percentage in the air will actually stay the same as at sea level, which is just under 21% oxygen. What will change is the barometric pressure, and that's basically the air pressure. And the further you go up, the lower that pressure will get. Now this will cause the oxygen particles in the air to disperse further apart. And this will reduce the amount of oxygen that you can literally take in with each breath. So when people are talking about going up to altitude to a low oxygen environment or less oxygen in the air, it can get a little bit misleading. So I just wanted to clear that up before we get into things. Now, this does cause a number of issues which are pretty commonly known. So to start with is when you're up at altitude, you'll suffer from reduced performance. So any type of exercise you do is going to feel relatively hard compared to what it would at sea level. Now, this first came to popular attention after the Mexico Olympics back in the day, where they saw that every single endurance event they ran up at the altitude they're at really suffered, and the times and the results were really poor compared to the other Olympics. The only sports that tend to thrive in this environment are those ones that are really explosive and really short. So things like sprinting, things like throwing, things like jumping, and the reasoning behind that is it's thought staying in the air is literally thinner. They can move through the air a little bit easier and a little bit quicker, and that'll increase them, improve them. But any type of sport where you literally need to breathe, it's going to reduce your performance. So number two is discomfort. So when you go up to altitude, you're going to find it trouble to catch your breath, to do particular tasks, to sleep, even your digestion gets messed up a little bit. So discomfort is a really common side effect. And then finally, the big one is altitude sickness. And this is what we're going to be mainly focusing on throughout this entire course. Now, the thing with altitude sickness is no one can really predict who's going to get it. Unless you actually go up to altitude and been up there in the past, you really don't know whether it's going to hit you or not. Mainly for the fact that a lot of it comes down to your genetics, and we can't really control them, unfortunately. What we're going to be focusing on in this course is all the other risk factors that we can control, and we're just going to try and get as much education and as many strategies in place so we can reduce this chance of altitude sickness actually happening. So, coming into altitude sickness, I'm going to talk a little bit about what it actually is. Now, I'm not going to go into too much detail with this, mainly for the fact that number one, I'm not a doctor, and number two, is most of this information you can find on the internet with a quick Google search. So I'm just going to go through the basics very briefly. So here we go. So to start with, there's a few different types of altitude sickness that have been defined. To start with, acute mountain sickness, known as AMS, is very common, and that's probably what most people going up to altitude tend to get. Now, the symptoms of this include headache, nausea and vomiting, dizziness, loss of appetite, shortness of breath. These symptoms are relatively common. The severity of them will change quite a bit person to person. The next one we're going to talk about is high altitude cerebral edema, or known as HACE. So this is a little bit more serious, and it can involve the swelling of the brain caused by a lack of oxygen. Now, obviously, anything that's going on with the brain, that's all a bit full on, so we want to be very aware of this. So symptoms here include headaches, weakness, nausea, vomiting, should say weakness of muscles, confusion, hallucinations, and things that it's just a little bit step extra than that AMS. Now, this is very serious. We don't want to mess around with this, so if you are suffering from this, you need help straight away. The next one we're going to talk about is high altitude pulmonary edema, which is known as HAPE, and that's a buildup of fluid in the lungs. Symptoms of this are blue tinge to the skin, difficulty breathing, even when you're resting, tightness in your chest, persistent cough bringing up a pink or white frothy thing, or tiredness and weakness. So that's it defined, just for your awareness and knowledge. But now we're going to go into how we can actually tell if you have attitude sickness. As I said briefly before, that mild symptoms of AMS are quite common. So things like your headache, your short of breath, your difficulty sleeping. The majority of people, when going up to attitude, will get this in one way or another. So how do you actually tell, one, if you have just got mild symptoms, or two, if you've actually got AMS as it's defined? So there are a couple of different methods which people tend to use to determine the severity of their AMS and use it as a judge to what their next steps are going to be. So to start with, there's something called the Lake Louise scoring system, which is a self-assessment questionnaire for the diagnosis of AMS. Now, people have been using this for ages. It's very simple, it's very practical, and it can give you a relatively good judge of where you're at. So what it involves is there's 5 categories, each with a different symptom for attitude sickness. So you've got headache, gastrointestinal symptoms, fatigue and weakness, dizziness, lightheadedness, difficulty sleeping. You're going to judge each of those on a scale of 0 to 3. And once you've done all that, you can judge where you're at, because if you have a headache and you also have a score of 3 or more above, you're going to be considered positive for AMS. And from there, you're going to have to make a decision and talk to someone about what your next steps are going to be. Another method people use to see what's going on inside their bodies when they're up at altitude is the use of pulse oximeters. So these things are little things that go on your fingers, and they provide an estimate of the arterial hemoglobin oxygen saturation, and basically see how much oxygen is going through your blood. Now, most trekking groups will carry one of these, and they'll tend to take it maybe once or twice a day. But you can buy your own these days quite cheaply just off the internet. So if you are wanting to keep a closer eye on it, you can just go out and buy one. Now, I'll be very clear here that these are definitely not 100% accurate. So either for your actual oxygen saturation or for the potential of attitude sickness. So the studies that I have seen have judged this, and they've gone up to altitude. They've used these pulse oximeters to keep a track of what's going on inside the body, and they've had a look at whether they can use it to predict attitude sickness further down the line or not. Hasn't always been 100% accurate on that, so you can't definitely use it as a one-stop thing to know what's going on. But it can be handy just as a bit of common sense. So if you're taking your blood oxygen saturations and it drops dramatically and you're also not feeling good, then it's pretty common sense that you've got to go tell someone who knows what to do in that situation. So whether that's your group leader, hike leader, or someone else up on the mount. So when it comes to treating altitude sickness, you'll quite often see on the internet people asking for, how do I stop altitude sickness? Or I've got altitude sickness, what do I do? What are the home remedies? So the issue with this is there are no real cures for altitude sickness once you have it. The main treatment for it is going down a lower altitude, which any time that you get altitude sickness, that's the first thing you should be doing. At the very, very least, if you do have the symptoms, don't ascend higher and wait at the same altitude for a couple of days and see what happens. And when the symptoms start getting a bit more severe and a little bit more serious, you really do need medical intervention. As we talked about before, some of them are pretty serious and you don't want to be messing around with things like this. So that's why there's stuff like helicopter evacuations on many, many mountains, because this can be serious life and death situations. So if you are worried about it and you are concerned about it, talk to someone who knows what the next steps are. So seeing there are no real cures once you actually have it, what we want to be doing is preventing it happening in the very first place. Because if you're going on one of these once-in-a-lifetime experiences and you put so much effort and time and money to being up on the mountain and attempting one of these treks, and you have to go home or go down and not actually make it, it's going to be incredibly disappointing. So we want to be doing everything that we can to prevent this. Now, as I said before, there's nothing that can 100% guarantee your success at altitude, and a lot of it does come down to genetics. But there are a number of strategies which we can control, which can help you when you're going up to altitude. And we're going to be focusing on that as we come through. So hopefully by the end of this course, you'll have a list of strategies that you can work on, which is really going to give you the best chance of success of preventing altitude sickness in the first place. So that's us done for our very first subject. A really, really short one today, but it's important just to get these basics out of the way before we move on to the interesting stuff. So coming up next is we got acclimatization, which is the process of the body actually adapting when you're in an altitude environment. So we're going to go through what that actually is, what happens in the body, and why that is so important if you're going up to altitude. So until then, guys, bye.